Okay, so this podcast, we're going to be looking at how to ace chiropractic college. So I think we both did fairly well at college, and we also both, right from the start, it's actually kind of how we met, started to study together and also started to get on our game fairly early on. And we also, I suppose, had a fair amount of motivation. But yeah, I suppose what we want to do with this one is just to give any tips or bits of advice for anyone that's about to study chiropractic, or maybe they're studying it at the moment, and yeah, how what can you do to really ace chiropractic college. Yeah, Andrea, what was maybe the number one thing that you're glad you did, or what's the number one thing that you did well that you think helped you to do well at chiropractic college?
The number one thing I learned, and I learned it after the first exams, uh, was to study early.
Hmm.
Like study every day throughout the year, and exams will be pretty easy.
Hmm.
The first, the first semester, I didn't read barely anything for the whole semester. Went home for Christmas. We're thinking like, yeah, I'll be doing some reading over Christmas. I have days off. Easy to get in a few hours. Did nothing. Came back to England and university 2 weeks before the first exams, and then we had 3 exams in 1 week, and it was just terrible. I lived 15 minutes away from university, walking,
Hmm.
but I normally used to cycle because that was just easier and faster. But during this time, I was either at university reading and studying, or at home reading studying, and then I was like, yeah, if I start walking, it will take me longer, and I'll have more time to rest. And then after that those exams, I was like, yeah, been there, done that. I'm not gonna do that again. And then I learned study, just study throughout the year.
Hmm.
Will make your life. Of course, you're gonna read a bit more before the exams, but if you read throughout the year or semester or before, yeah, you'll make your life so much easier.
Hmm. Yeah, you either make your life really easy at the beginning of the year and then super hard just before the exams, or you spread the load out all the way through.
Mm,
Yeah, and sometimes you just need uh, something like that experience, like your exams, to teach you that. But you didn't actually do that bad though in the end, though, did you? In those exams,
no, I did.
you still passed them, didn't you?
I still passed, Stephen.
Yeah. but
Yes.
but it's probably a bit too close than what you would have liked.
No, the results was embarrassingly good,
Okay.
but that's not. It was just stress.
Yeah. The
Stress.
process was harder than
Oh,
it needed to be, I suppose.
yeah,
Yeah.
exactly.
Yeah. Yeah. For me, as soon as I started college, so like A level, so 2 years before starting chiropractic college. In fact, actually, even a little bit before that, as soon as when I was in school, as soon as I knew I wanted to be a chiropractor, I knew that whatever I wanted to do, I wanted to do it really well in life. And so as soon as I knew that, I was really motivated. So I was terrible at science. And then as soon as I knew I wanted to be a chiropractor, my kind of science level went high really quickly, but it was right at the end, so it was only so far I could actually get it up. So I didn't exactly ace science back at school, but I certainly did a lot better because of the last 6 months I actually put a lot of effort in, because I suppose I put a practical like I knew why I was doing it suddenly, whereas before I didn't know why I was doing it. Uh, I didn't know I needed it in life necessarily, but as soon as
Mm.
you know you're doing it for a purpose, for me at least, it motivates me, and that's why I almost wish at school they spent a bit more time saying why you're going to do it. And that's the unique thing about chiropractic, is that we all know why we're doing it. And so for me, it was really easy to find the motivation, because I knew that the better I do here, the better I'm going to do when I am in practice, the easier it's going to be, and the better I'm going to be, and the better results, etc. So you're going to make your life a lot easier. So I was quite motivated right from the start. So I remember um, I was studying pretty early on, as soon as we got to college, and which is probably not like most people. probably a bit geeky, really, in that respect. And I even remember when I went back to for Christmas, I created myself a timetable, which I would totally recommend for anyone. I think I did better at. Funny enough, I was like the opposite to most people. I did better at this in my first year compared to then. I got a little bit more lazy as I got through for some reason. So I would write down all the subjects I needed to study. I'll then decide how many hours is reasonable to spend each day. And I only did like a few hours each day. I don't think that you can effectively study for more than that. At least I can't each day. And then I tallied up all the hours I had, and then I assigned priorities. So, certain subjects I knew that were harder or required more time, I would prioritize those, and I'll put how many hours each one, and then I'll fill my timetable. And then I literally followed it, and I followed it pretty well. So when I came to those first exams, I was actually quite well prepared. But that was always my my way of doing things, was start at like I hate the idea of cramming. I hate the idea of cramming. I think cramming is a great way to pass an exam easily, but I didn't really want to just pass an exam. I wanted to actually retain the knowledge. And I think if you do study early and you repeat that study, so if you read a like we would often do this, wouldn't we? We would read our syllabus, our book, and then we'll end up reading it again before the exam. And that second time you read it, it gets it more into your long-term memory. And the first time really just gets it into your short-term, which is great for passing an exam, but then you forget everything all the way at the end. So yeah, interesting. But yeah, I think the lesson there is start your study as early as possible. It seems fairly obvious, I suppose.
Yeah, and then I don't get this. You said it, but if you study for more than 3 hours a day, either you're a genius or you're not studying for more than 3 hours a day.
Yeah.
I don't get how you can study effectively for longer than 3 hours.
There's certain... Sorry, go on.
You go for it.
Well, yeah, I think that there's certain things you can do after those 3 hours, but trying to retain knowledge is not one of them. I think I even remember Jordan Peterson saying that. He said you can only really study for 3 hours. After that, yeah, as you say, you're not studying, right? You're just like, and he said, oh, I know those students that are in, say they're in the library all day, and he said half the time they're on the phone or they're chatting or whatever it might be, but the effective study they're probably not doing for the whole time. So it's more quantity.
Yeah, I don't even know how you can study effectively for 14 hours in the library 2 days before the exam.
I suppose the one thing you have 2 days before the exam is a huge amount of motivation, because you have to. And I think for some people, for some reason, that is what they need to motivate them to study. Whereas I get stressed about exams really, really early, like not massively, but a little bit enough for me to think, right, I'm just going to get on this straight away. Like I do not want to get a few days before the exam and I haven't done anything. That would just it would overload me. But some people, they almost thrive on that, and they'll do all-nighters, and that's just the way they study.
Yeah,
I don't think you're going to be very effective at studying if you're doing it all-nighter with a lack of sleep. But for some people,
you're crazy out though, Steve. You're crazy. You hand in your hand-ins like 2 weeks before the...
Yeah. But logically, that makes sense, doesn't it? I don't know.
No, it doesn't. It's like pre-traumatic stress disorder.
Yeah, I clearly wasn't a student if I didn't hand it in like 1 minute before. Hand in. People I knew that did that. Did you do that? Like 5 minutes before?
Yep. Yes, sir.
That just seems too risky, man.
Well, yeah. I guess you are correct, but then I don't know. I can't even. That's the problem with people like you. There's no way to defend your stance if you do it differently.
No, exactly. Yeah.
You definitely do it the wrong way.
Yeah. So anyway, uh,
So, Steve, what other things do you do to ace chiropractic college?
well, I think you got. I think you got to sharpen your saw. I think you got to spend a bit of time, and this is hard because you think I don't want to waste time doing things that's not studying the subject I need for my exam. But actually, you could say that the same thing if you're going to chop down a tree. You got a blunt saw. You don't want to waste any time not sawing. But actually, if you just spent even half an hour sharpening that saw, you would then get through that tree twice as quick. And it's exactly the same. You can apply that concept with many things, but it's exactly the same with um, studying. Uh,
Mm.
so many people can study and be really inefficient, kind of what we were talking about. But if you're really efficient, firstly, you're not going to have to spend all day, every day studying and make it your entire life. Um, but yeah, also you're going to be more effective and you're going to do it better. So I think yeah, just find out how you study the best. There are so many YouTube videos out there on how to study effectively, and just find what works for you. Like for me, that timetable that worked for me at that time at least. Um,
Mm.
uh, yeah, but and then also like how to remember things. So yeah, for me, like the Quizlet flashcards worked really well. Not for everything, and thing about flashcards, they do take quite a long time to make. So I would only do them for certain things, such as like the muscles in the body, because I
Mm.
knew that for us that's a really essential part, and it's something we're going to have to keep going over for many many years. So me creating those flashcards was really useful and definitely helped cement it all in. So yeah, just finding study techniques and being intentional about how you're going to do it, rather than just kind of flippantly opening a book and seeing how it goes, kind of thing. And then you realize, oh, I haven't done enough just before the exam. Now I'm going to have to cram. That's really what you want to avoid. Uh, um,
That sounds very smart, Stephen.
hmm. So I think they're I think for me I think they're the top two. Is what was it? Study early. That would be the number one for me, and then study smart. Um, yeah. Is there anything else you would add onto that list?
Yeah, there is for sure. You can't study for more than 3 hours a day. At least I would be very intrigued to hear how you do it. But what you can do, especially as a chiropractic student, is study for 3 hours and then go and do practicals with your friends or study group or
Of course.
whatever. So you definitely want to get a group of people together uh, and practice your routines. That's where it's. But yeah, your routines and your skills for whatever exam you have.
Yeah, because this is the unique thing about chiropractic is um, it's not just about the theory side; it's about the practical, and actually
Mm.
they're just as important as each other. So you want to do the thing. If you got a day, you want to do the thing first that's going to require the most amount of brain power. The thing that you can't do if maybe you're a bit tired, and the practicals you can effectively do that for longer than you can do theory. Let's say. I mean, yeah,
Mm.
you do get a bit exhausted, but you can actually just keep going. And other things you can do as well after those 3 hours is things like just creating those Quizlets because they don't require too much brain power. So actually, you can spend the whole day, but provided you do it well. But if you did the practicals first and maybe did some flashcards, and then you wanted to do some studying afterwards, you can have less brain power. But yeah, utilizing your colleagues, your friends,
Mm.
studying together, 100%, that really helps.
And if you're going to study together and do like non-practical stuff, just do it well. Find a way to do
Obviously.
it. That no, but obviously no. But like I know I've been in rooms where we tried to study as a group, and it was just
True.
a waste of time.
Yeah.
It was fun and social, and you get to hang out with your friends. But yeah, if you just read those pages and remembered, that would be so much more efficient.
And to be able to do that, you need to be studying with the right people.
Yeah.
Because there's some people you just, it might be that some people are just not actually that interested in studying. That's going to be problematic. But also there are some people that are very interested in studying, but they just study very differently to you. So perhaps maybe studying with that person is not going to be the best. So you've got to find someone that studies, where you can be efficient together and effective. So something that I really love that we did is that we will go to one of our houses, chill on the sofa with a book, and then we'll just fire random questions at each other, or based upon maybe certain subjects. So one of us put the book down, and then you would, ask questions, and then I remember we'd be like, "Oh, I know this answer. It's on page 297 at the top right."
Yeah, that's what it was for you.
That's when you know you have read it a lot, but
yeah. That's
so that worked for us. It might not work for everyone, but also it's just a different way of studying. So I feel like I could do the 3 hours studying, and then I could go around yours, and we could then do those firing the questions. And particularly after a bit of a break, maybe just socializing a little bit, then you just have a bit more. It just requires, for some reason, I don't know, it's a different part of the brain, I suppose. And then the good thing about studying with other people is it's the easiest way to find out what you don't know, to find out the holes. Because you can study by yourself and think, oh yeah, I know this, but until someone fires a question at you or starts speaking about it, you think, oh, actually, I didn't know that one, and so you can go back and then fill in your gaps. So,
true. Yeah, I think that's for me like the way to do well at university.
So what about the practical side of things then? I mean, how often would you say you should practice the practical side? What's the best way in terms of the adjusting technique? If someone wants to become really good at adjusting, how would you do that, and how quickly should you start? How do you start?
Well, that's easy. I know the answer to this one. It's all about quantity. It's like adjustment. If you want to get good, it's all about quantity. An hour a day, every day, for 5 years. Or if your course is 4 years. I think that's a good start. You'll not be the worst newly graduated chiropractor if you practice that much.
Yeah, definitely.
And then you'll have to do other stuff like neurology and orthopedics and I don't even know what you have.
Yeah, I think from the top of my head, you've got 3 things. You got adjusted technique. You got the exam, because when you're examining someone, you want to be able to do it. Bam, 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 bam. Like, this person's got low back pain. I think the ideal way of doing it, from the top of my head, is someone's got low back pain. What are the differentials? What tests do I need to do to rule in or rule out these differentials? So at the end of the exam, I have one that is most likely, and then I've got diagnosis. So you need to be able to have that routine in your head to be able to do that, but also be able to know, once I've done this test, what does it mean if they, I don't know, because you could do a test and it's not like there's just 2 outcomes. There's many outcomes. Like, you do a straight leg raise, they might get pain in the foot, or they might get pain in the back. They might get pain at 25 degrees, or they might get pain at 45 degrees. What do the 2 mean, and what does it mean in regards to your differentials? So being able to, and then some of that is hard to do until you're actually doing it, because when you're practicing exam, you're not getting any results. That's kind of the difficulty with it. So you get used to just doing the exam on each other without really listening to or seeing what the results are. So sometimes I've kind of done that with a patient. I've just gone through an exam and think, I haven't really paid attention to the outcomes of the exam, or just going through the motions. So you can have to get that out of your head. But the first thing to do is to be able to do the test well. But yeah, I think there's three things. I think there's adjusted technique, there's the exam, and then communication. And I think the communication we perhaps didn't spend too much time. We did spend some time, but not that much time doing. But also, it's quite hard to do communication because it's a bit fake, isn't it?
It's like, here's how you do this genuinely and honestly, but just do it fake.
Yeah, exactly.
Yeah, I hate to practice those kind of things. It just feels.
I think though, one thing that I would advise people to do doesn't have to be that early. I would say you probably want to do this maybe half a year or maybe the last year before you go into the clinic, is just to practice a report of findings, like a general report of findings. I think the thing that really helped me is not necessarily to have a script. However, if you were to write your own script, it's actually a good way to start because you get then key phrases that you word in a way that is good and that is the way you want to come out. Because if you go into a report of findings and you just wing it, you end up saying things that you are like, oh, I shouldn't have said that, or that didn't sound very good, or that wasn't the best way of conveying that. So it actually really helped me of writing my own script, learning that almost word for word. And then after that, I created a structure. So I just like 4 points. So my points now when I go into report findings is tell the patient what the problem is, what's causing the problem, how we're going to fix the problem, the plan going forward, how long is it going to take, how many sessions, and then the expectations. So I would expect them to respond based upon this condition. How far does this typically go? Warn them that things might get worse before they get better, or they might take a few sessions, etc. So for me, in that, having those structures in my head, and then as I go through them, I've got key phrases that are like almost just sentences that are worded nicely that I just pull out at the right time. So being able to practice that early on would have really helped, because I remember when I was doing my report and findings at college, I didn't really have that, and we kind of practiced report findings, but I don't really feel like we did it that well. I don't know what your experience was.
Yeah, I think there's a cultural difference between report of findings in England and Norway, for sure. And then you're doing it in a different language. So your phrases doesn't always translate that well. So yeah, you want to learn how to communicate effectively and clearly with the patient, so they know what's going on. But I think that's more after college. Like at college, it's the exam as well. When you practice, you do a test, you try to interpret the results from the test, and then what to do about it. I don't follow the routines we got when we were at college, and I bet you don't either. But at college, just do what I tell you to do. Some people will tell you how stupid one of these tests are, and then you end up using it all the time.
Yeah, you learn the routines. Like you've got the low back routine, and you don't really do it like that because some of the tests they're useless for certain people. It's actually because every time you do a test, ideally you want it to change something. And if you're going to do it and actually it doesn't matter what the outcome is, it doesn't change anything, then what's the point of doing it? So, but it's a good way to practice it like that initially, because then you're practicing, you got to practice somehow, don't you? And practicing the routines like we did, actually, it's not a bad thing. Helps you just remember the test, helps you to remember this is a low back test. But it's just not the way you can do it. So yeah, things do change naturally as you start to actually see patients.
True. And then I think that's the only way to do it. Like if you're gonna check someone without a problem, you just have to have something to decide what test to do.
Yeah.
and then low back routine is a good way to do it. Otherwise, that exam would be so easy. This patient has no problem. Do the test you want to do.
Yeah, no test.
See you later. Pay in the reception.
Yeah, exactly. Yeah, good. Okay, well,
and then also, I think when you're studying, I remember I lived with a guy who was in year 5, and he got like a free seminar as a part of his course, and that was the first like it was on campus, but like off campus seminar. And he was so excited, and he was like, I can't imagine why I didn't do this before. And I really can't imagine why I didn't do it before either. It's so easy to get fired up and motivated and ready to learn and improve and study after you've seen someone who's doing it really, really well.
Yeah, absolutely. You want to keep yourself motivated, and college doesn't always do that very well. Sometimes you can get almost demotivated, depending on your lecturers or depending on what you're doing. But seminars, you're being taught in seminars by chiropractors who are studying. Normally, they've studied for long periods of time. They love what they do, hence why they're doing a seminar. They're usually very good at whatever they're presenting, hence why they're doing the seminar. And also, seminars are stupidly cheap when you are a student compared to when you're a chiropractor. So take full advantage of it, man. The amount of seminars I did. I started seminars in year 3. I think we both did, didn't we? Around about year 3. Maybe we did.
I did.
Oh no, we did one in
year. Pat?
Yeah, that's right. Pat Parkinson's. The one like the hypnosis, like the brain. Yeah, in year 2.
Communication, psychosocial.
Yeah, exactly. Yeah, that was quite a big seminar actually, wasn't it? But that was when we started.
Yeah. Started year 2, wasn't it?
Yeah. So the earlier you can start doing seminars. I remember someone telling me that when I was studying, just go to as many seminars as you can. Because you'll just learn things you don't learn at college, but you'll keep yourself motivated. So go to at least a few a year, but also, I'll say do as many as you can. But particularly, I remember Lawrence King's seminars or the Gonstead Cox seminars. We always came back feeling very fired up, and even now, like if I when we do our seminars or when I go to a seminar, I come back and I feel like I'm just better with my patients because I'm just so much more confident, more motivated about what I'm doing. So yeah, it's more about what you, not just about what you learn at the seminars. It's also about keeping yourself fired up.
For sure.
Yeah. So I think they're the main points, really, aren't they?
Yeah, I think if you do those things and do it well, you'll do well at college for sure.
Yeah. So study early, study smart. What's the other one? Sharp. Oh no, that is study smart. Study with people, study groups, and keep yourself motivated through seminars. Generally, the main things, aren't they? And it's not rocket science. It's just getting yourself to do it, isn't it? That's half the battle. So.
Oh yeah, that's true.
Yeah.
When you're kind of tired, to sit down and read. The good thing when you're not in uni is that you can just read whenever you feel like it. You don't have that luxury in university. You just have to get it done. Yeah.
You have that pressure of exams in uni, so you have to read. And sometimes when you have to do something, it's maybe not always as pleasurable. This is what I like about what I'm studying at the moment. Is I can take these exams whenever I like, and so I can do it at my own pace. And it's just a bit more pleasurable because I might have times when I can't be bothered to study right now. So I won't, or maybe I'll take a week off, or maybe I'm really motivated. Let's just get through those now. So it's just, you're going to be way more effective when you're motivated. So.
Perfect, Steve.
Good. All right. Well, thank you all those that have stayed tuned with us this far. See you on the next one.
Bye.